Good morning and good afternoon to everyone across the country and beyond. Hello and welcome to today's webinar entitled Maintaining and Strengthening Patient, Family, and Caregiver Partnerships. I'm Carol Fancott and I will be moderating the session today with our host Claire Sneidman, who is a patient partner from beautiful British Columbia. So I do want to thank you for joining us from wherever you are across this country and beyond. I do understand we have some international guests joining us today as well. I am coming to you from my home office, which is located in Toronto, and would like to acknowledge that this is the traditional territory of the Huron-Wendat, the Anishinaabe, Haudenosaunee, and the Mississaugas of the Credit. And it continues to be the home of many First Nations, Inuit, and Métis people from across this country. And I would also like to give a quick thanks to our amazing CFHI broadcast team, who is also coming to you from their home offices, which are located on the traditional and unceded territory of the Algonquin people, which is also where the CFHI office is located in Ottawa. And as I acknowledge these lands, I think of my own connection to the land, and I look at this photo of this glorious tree in an urban park, and I think of all the places that you're joining us from as well, and think about the enduring presence of Indigenous peoples who have inhabited this land from the beginning. And I'm very grateful that we've been able to gather from wherever you're joining us today. Now, before I pass this on to our host, Claire, I would like to go through a few housekeeping items. One is we're very pleased to be offering this discussion series bilingually. So you will see the telephone number to connect to the French audio is on the screen, and that we invite you to put in your comments and questions in either official language into the chat box. Secondly, I would like to remind folks that this session will be recorded, and we will be archiving it on our website, which you will be able to find there within a week. And lastly, as we had developed this discussion series, really the main purpose was to connect all of us from coast to coast to coast to share and to learn together, as there were rapid changes happening in the world of patient, family, and caregiver engagement during this time of COVID-19, and really wanted to include multiple voices in this discussion, those that are working within health organizations, health systems, and of course our patient, family, and caregiver partners. To really gain insights into the innovative practices that are happening now, but also where the challenges remain. And for those of you that have joined before, you will know that the prime way that we have this discussion is through the chat box, which I see is filling up quite quickly and continues to move quite quickly as we move into our discussion. And so we do our best to raise the comments that are coming through in rapid fire, but please rest assured that the comments are saved and that we do provide a summary of what's written through the comments and the questions that are asked, and this summary gets posted on our website shortly after the webinar. But as I mentioned earlier, the webinar is also recorded, so you can go back for your listening pleasure at a later date. So I am very excited about today's session, because as much as we know there have been some ongoing challenges in engagement during this time, we also know that there are a number of bright spots that we can celebrate and we can learn from. And so in today's session, what we are going to be exploring are these innovative and creative approaches to patient engagement during this time of COVID. But not only thinking about the what, we're thinking about the how and the why. What is the context that has enabled patient engagement and partnership to thrive and to be strengthened during this difficult time? And again, thinking about the challenges that remain. And then importantly, we know that we are living in a new world right now and that the future remains uncertain. And we want to think about how COVID-19 may be shaping the engagement landscape in the future. And so I would like to hand it over to Claire with a few words of introduction. So pleased that you're joining us, Claire, from BC, as a patient partner who has really help to inspire others to put health in their own hands. Now, Claire is an author, a speaker, a blogger, and an advocate for patient and healthcare collaboration. And this was sparked by her personal journey with a brain tumor and brain surgery, which she has written a book about called 2 Steps Forward, Embracing Life with a Brain Tumor. And this is based on her personal journey from diagnosis to recovery from brain surgery. And as a patient during this time, Claire realized the importance of partnering with her healthcare team and really becoming her body's own advocate to be able to take responsibility for her own health, and through this team management approach, be able to best manage her own care. So over to you, Claire, and welcome.
Thank you so very much, Carol, for the introduction, and good morning to everybody across Canada. And I'm calling in from the North Shore of Vancouver, where I am most grateful that I actually get to live, I get to work, and I get to play on the traditional and the unceded territories of the Coast Salish and Tsleil-Waututh and Musqueam First Nations people. And thank you very much to CFI for inviting me to participate today on a topic that really is very close to my heart as a patient partner, but also in the work that I do and the work that I hope to be able to share with you today. So it's the role of the patient, family, and caregiver in engaging with healthcare systems and collaborating and co-designing with them through their lived experience and input is really integral to being able to help improve quality of care. And for me personally, I've come to realize just how important it really is over the past years. Because for me, my own story as a patient partner in Canada began about 10 years ago when I was diagnosed with a brain tumor which required brain surgery 2 years later. And my navigation of the healthcare system during that time was somewhat challenging. And so this led me to use my personal experience to try and figure out ways to sort of work with the system instead of against it. And for me, patient engagement and partnership really have become intertwined with my healthcare journey as an individual who manages multiple chronic conditions. My experience as a patient partner has been across many different areas as I continue to collaborate and learn. And I also actually work collaboratively with healthcare organizations and authorities as a consultant in patient experience and patient activation. And I'm really thankful for these opportunities because I get to engage in this work, and I'm very humbled by some of the patient partners and some of the healthcare staff that I get to work alongside. So I'm going to take you back, and if I could go to my first slide, I'm going to take you back to the first weeks of March with the onset of COVID. And I don't think that I'm probably the only one who saw a shift in engagement and partnership levels. And for me, this means things slowed down. I went to sort of the on-hold mode, the first traffic light that stopped, where a lot of opportunities were put on hold as resources were, in many cases, understandably shifted to the COVID response. And I know from chatting to other patient partners during those initial weeks, many of them felt like they'd perhaps fallen off the grid and not knowing if and when those partnerships would ultimately renew. In BC here, I saw at first a glimpse of hope that moving from the on hold to maybe sort of that in between. It was in the third week of March, and it actually came from the BC Ministry of Health. There was a call out for patient partners to engage on what was termed the COVID-19 response for citizen patient-facing tools. And by the end of that week, all patient partners and the Ministry of Health had already met on Zoom. We'd engaged on a beta test version of a new app design, and we'd already given feedback. Patient partnership can happen with immediate response, and this really got my engagement juices flowing. So this engagement opportunity really highlighted two things for me. Firstly was the importance in this critical time of the voice of lived experience and the way in which patients, families, and caregivers really had a huge appetite to contribute during COVID, and the timely response was really not an issue. And secondly, the forward-thinking response from a provincial health authority at the get-go of COVID to reach out and actively engage with the patient community to seek input, and so very quickly, was really inspiring. You know, as the COVID response continued and things like the visitor policies were clamping down, Various other communications were starting to go out. For me personally, some key questions were starting to come into my mind. For example, what was the impact of these decisions on patients, families, and caregivers, and how are they being messaged? And how could the patient lens help keep person family-centered care in mind during this crisis? And what about the after effect? How could the patient family caregiver lens help bring light to some of the issues that would be faced in these communities afterwards? And how could the patient family caregiver lens assist in the emergency preparedness planning and pandemic planning actually going forward? It was actually during this time, and I'm sure many of you may have done the same thing, that I was actually attending some various great webinars on COVID, patient engagement, patient experience, and I had seen great examples in that chat box that you're probably typing into of other patient partners in Canada who were working on some initiatives to address these questions that would be coming up in my mind. So I reached out to some of them for information on them. And this is something that I've seen as a great positive actually during this time, is the uptick in patient partner engagement. So with this great information in hand, I put a plan together and I presented it to the healthcare authority I was working with. And the reason I'm sharing this information with you today is because of those patient partners that I learned from who helped me create my plan. And this created what I think is like a way forward, moving that traffic light from that in-between to a bit of a green light. I'm going to take you through what that looked like and how that really started to create some patient engagement and patient partnership opportunities during COVID. The key purpose of the plan that I put together was really how do we bring those valuable perspectives and input from the patient, family, and caregiver community to ensure that person, family-centered care is maintained and supported, and the impact on patient experience is understood during COVID. So there were really 4 buckets that I looked at, and some of the areas of opportunity were, for example, communication. So how could we look at assisting in the creation and review of communications that were going out? How do we make sure that the message resonated with the communities it was intended for? For example, was health literacy being taken into account? Another bucket that was really important was, how could we potentially identify and advise leaders, healthcare providers, staff, and physicians on planning and decision-making around the actual delivery of person and family-centered care during COVID and during that emergency and pandemic situation. At the same time that this is all going on, I've been reading some excellent insight into the first, second, and third, and fourth waves of COVID. Maybe you've seen this as well. And I felt it was really, really important to make sure that this plan looked actually beyond just the actual now and into the future waves that would most definitely be felt by the patient, family, and caregiver community. So this plan had a third bucket that really looked at how could we identify and understand those issues that would be faced by patient, families, and caregivers after that crisis, after the first wave had ended. And also, how could patient, families, and caregivers assist in planning for emergency, pandemic, and related situations that would be happening in the future. So this plan was met with enthusiasm by the healthcare authority for actually bringing patients and families and caregivers and their voices to the table in this unprecedented time of crisis. It was still the challenge of balancing the COVID response mode of the healthcare authority with actioning this particular plan. So I did have to knock on the door a few times for it to open. But just recently, we managed to roll out a council to address all these identified issues with patients, families, and caregivers on board. And I've been working with some key partners in the healthcare authority who have a passion for patient experience, and this has been incredibly rewarding. Their determination to bring this to light while they're being pulled in 5 directions is incredibly encouraging, and I've been humbled by their dedication. Now, this plan is fluid and dynamic, just as our lives with COVID is currently. So we have processes and parameters in place to ensure functionality, but flexibility, communication, and partnership in a time of change is really key to success. And I hope that we'll be able to look back on this initiative in a year's time and see the positive results of setting up a strong patient-family caregiver engagement during the time of COVID. And as a patient partner, the COVID pandemic has highlighted a few things about patient engagement and partnership for me. So firstly, Patients, families, and caregivers are ready to engage and give feedback as quickly as required. This should never be a barrier to engagement. Secondly, it is important for us to look forward and into the future to put structures in place to strengthen patient engagement and partnership to ensure it does not fall off the radar again during a crisis or any future waves of COVID that may occur. Thirdly, never be scared to raise a hand. Even in a crisis, if we think there's an opportunity for the better good of the patient voice and quality of care. And last but not least, if you knock on a door and no one answers, it doesn't mean they're not home or interested in seeing you. They may be busy or can't hear the door. Come back later and knock again. If they don't answer, make sure to leave a note so that they know that you called. Thank you.
Thanks so much, Claire, and some wise advice there. And I see that much of what you were saying was resonating when I'm looking at the chat already. A couple of comments, especially when you raised early on some of the questions that you were raised, and I think Susan Dunn had also expressed one around supporting organizations, Susan Mills I'm looking at, regarding the blanket visitor ban and questions about that. And I think to your point, so the last one about knocking on the door, Susan Dunn has also commented, how can we support organizations if they're less keen as a result of the impacts of COVID? And I think your green light, yellow light, or red light, yellow light, green light, I think demonstrates some of the movement that's happening. I'm going to move us along now and introduce two wonderful partners that we have worked with at CFHI from the Center of Excellence for Partnerships with Patients and the Public based out of the University of Montreal. I will start with Vincent Dumez, who has suffered from severe chronic diseases over the past 3 decades and more, and he really has been such an active supporter and promoter of the concept of patient partnership at the University of Montreal since 2010. He is currently the co-director at the Center of Excellence now, and also at the Collaboration and Patient Partnership Unit at the University of Montreal's Faculty of Medicine. So he's worked on many, many projects in the area of patient partnerships with the Ministry of Health and Social Services in Quebec, CIHR, the World Federation of Hemophilia, Royal College of Physicians and Surgeons, and I could go on. And I think notably, Vincent was a member of the Advisory Council on the implementation of the National Pharmacare Drug Plan with the Government of Canada last year, and we've heard the results of that. And full disclosure, Vincent is also a board member here at CFHI and also sits on a research foundation board in Quebec. And over to Caroline as well. I will introduce her. She's the executive co-director at the Center of Excellence. And there she is helping to direct a huge interdisciplinary team of patients, caregivers, clinicians, project managers, and researchers that are really working to transform healthcare. CE by mobilizing the lived experience expertise of patients and families. The Center of Excellence is a patient co-led organization that fosters and supports opportunities for critical stakeholders to truly work in partnership to address the challenges of today. And the Center of Excellence vision is to ensure that healthcare of the future will be co-constructed with patients and the society that it serves. And so just with that intro, I think that's a forecast for what is to come, and they will be sharing some of the great work that's happening through the center in Quebec. So over to you, Vincent and Caroline, and welcome.
Great. Thank you so much. I hope everybody can hear me. So thanks, Claire and Carol, for that lovely introduction, and bonjour à tous. So it's a real pleasure for us to be here with all of you. On behalf of all of our team of the Center of Excellence on Partnership with Patients and the Public, we really want to thank CFHI for this invitation. So Carol knows us pretty well, and she knows that Vincent and I are rarely at a loss for words. So it's going to be our challenge in the next, hopefully, 15 minutes to share with you what our team at the CFPP, our community of patient and family partners, and some of our close collaborators have been doing to continue to mobilize patient partnerships since the start of the COVID crisis here in Quebec. I'm going to try to give you an overview with this first slide about a bunch of the different levels of which we've worked, and then I'll pass it over to both my friends and my partner in crime and our patient leader, Vincent Dumez, to speak more in depth about the impact of a few of these experiences. I'm going to speak in English, he's going to speak in French, we're going to mix it up. And then, of course, we'll be happy to answer some questions. So to respond and to kind of reflect on a lot of the things that I'm hearing in the chat, we also thought that patient partnership and the activities at our center would be put on hold or would be left out of any responses to the COVID crisis. And like many of you expressed now and also in past webinars, things were changing really fast, and we thought that engaging patients and families wouldn't be a priority for the partners that we traditionally work with. But actually, to tell you the truth, to our own surprise, what we experienced over these past few months, and we're hoping that that can give hope to the rest of you, is that it's been a bit of the opposite. And this slide that you see in front of you shows a few key areas where we've gotten involved. And I think the point here is that some of these things were initiated by us at the center, but a lot of them were also driven by key health leaders and collaborators that really believed in the importance of mobilizing patient and family partnerships during this time. And the fact that those relationships existed really helped to get these things moving fast at the very beginning. I'm going to start at the bottom corner of the pyramid that you see there, but one of the most important things for us at the start of the crisis was really to find a way to maintain a link with our community of 300 plus patient and family partners that we have in our community, our close community of the center, because we really suspected that many of them would not only be worried about maintaining their ongoing engagements, as many of you had expressed, but also the consequences of chronic of COVID itself, because many of them suffer from chronic diseases. So what we did is we created a survey that we send out every 3 to 4 weeks to this community to measure a bit how they're living through this period, how they are or are not being mobilized as partners, and to try to capture what some of their concerns and experiences are over this time. This has given us a chance to get some feedback, but also most importantly, let them know that we're still there. And I think that's one of the things that we encourage people, obviously, to do whenever possible. We also reinitiated a regular event series that we call Les Belles Soirées for patient partners that we moved to a virtual format, and this allowed a space for patient family partners and our team to stay informed about different partnership activities that were going on in our network, and also discuss COVID-related subjects that were interesting to them. And these activities, the reason I bring this up is because these activities really helped us to serve as a barometer and a pulse check with this community of patient and family partners, and to kind of see how things evolved over time. And to be totally transparent, it wasn't always the easiest discussions, and we saw the fears and the anxieties and the concerns expressed over time. At another level, the one above there on the presentation, in partnership with Dr. Marie-Pascale Pommet and other collaborators, we also started a bi-weekly French webinar series that was really targeted at, similar to a lot of the people around the table, but the experts in patient partnership and patient partners in the Quebec Health and Social Services Network and other international Francophone collaborators that we have. And similar to this webinar series, we really tried to highlight the examples of patient and citizen partnership during COVID and provide an opportunity to discuss challenges, share ideas, and innovations, and different organizations had come up with. And so that was a great way to keep everybody motivated, and also to encourage people to reach out and get back in touch with their patient and family partners. We've been involved in the launch of a new Quebec research network that's focused on COVID research, and in fact, Vincent was named as the patient co-leader of this network with 2 internationally renowned researchers, François Lamontagne and Nathalie Granvaux. And our center's involvement has really been trying to make sure that this network gets going with patients and families and citizens that are continuously involved as the research also evolves, and also to help make sure that the research questions are not only concerned with those that are affected directly by COVID right now, but those that will and can be affected by this pandemic, and unfortunately future ones, that to make sure that we're prepared for future pandemics. So those are some of the things that we kind of were able to initiate and get involved with. But one of the coolest things that we've really had a chance to mobilize and get active on is that we were lucky that a number of our partner institutions and organizations that we've worked with in the past contacted us pretty early on to rapidly mobilize patient and family partners on a whole bunch of different topics. So we've been involved in reviewing procedures and communications to deploy telehealth functions, brainstorming ideas and co-designing recommendations on how to maintain patient and clinician relationships, especially in situations now in hospitals where even healthcare professionals are keeping a larger distance with patients. Evaluating new technologies that are being used to treat patients at a distance, both in the hospital and home. And also, one of the cool projects we've been working on has been creating a virtual community of patient navigators and volunteers that are able to continue to support patients, especially patients that are isolated in hospital right now, but in a virtual way. And I think this touches on something that seems to be brought up a number of times in the chat, but we're also working now on developing a curriculum for family members and informal caregivers that could allow them to be certified as members of the care team, and thereby, considering that in the future they should be considered also as an essential member of the care team with specific competencies that are necessary even in times of confinement and isolation. Finally, our main sort of thing that was, I would say, has been really interesting and to which Vincent will speak to shortly. So Vincent was invited to join as a patient member of the Tactical Committee on Ethics for COVID that was created by the Quebec Ministry of Health and Social Services. And in order to support him in this important role, we quickly set up a COVID Citizen Patient Partnership Task Force that we call the C4P. That's primarily made up of patient and family partners, but also includes clinicians, health managers, public health specialists, and other members of our team. We really tried to include in this group individuals with lived experiences that we thought would be the most pertinent to the trajectory of COVID-19 and also those that could be affected by the reaction to and other consequences of COVID. It happened pretty quickly, so we've evolved over time, but this is one of the reflections that was quite important to us at the beginning. And so this committee now includes individuals with lived experience of elderly and palliative care, high-risk immunosuppressed patients, people who have experience with confinement and isolation, individuals with chronic conditions that are obviously affected by a lot of the healthcare changes right now, including people with experience of mental health issues. And also, once we were able to identify some of them, we actually now have some patients and family members who have lived with COVID that are involved in these reflections. So this group has been mobilized to help reflect on some pretty intense subjects. You see a few of them there. Such as policies and recommendations for triage in situations of resource scarcity, communicating on preferred levels of care for COVID-positive patients and their families, changing triage procedures for surgeries where there's been a lot of adjustments as well. And one of the cool things I think about this group was that after the first couple of weeks, we were also able to suggest topics to be reflected on from an ethical standpoint, and such as the potential shortage and scarcity of drugs that could happen for non-COVID patients because of the reaction to COVID, and more recently addressing challenges in long-term care homes and end-of-life care, which, as many of you may have read, was a subject that's been particularly sensitive here in Quebec. So that was my very rapid overview, and hopefully you can see that there. But I think the main point of what we wanted to emphasize here was that, and this goes to what Claire was saying, there's a lot of places clearly that patients and family members can and should be involved, and we've tried to mobilize that at a whole bunch of different levels, and I can see that that's happening around this table as well, and I encourage all of us to continue that work. So now I'm going to hand it over to Vincent, who will let you know if I missed anything and also share with you a bit more specifically about how we mobilize this group and our team and some of the key takeaways that we've gotten out of this experience.
Thank you. Thanks very much for presenting the initiative, Caroline. There was a question I saw in the chat box. How do you raise awareness amongst leaders and departments, ministries, regarding the engagement of patients and patient partners? It's something we've looked at closely because we feel the best way to raise awareness is, in fact, to show that they add value. Involving patients is morally correct, yes, but we do it for the added value. And in everything that Caroline has described, you can see that we observed that added value, and it's significant. It's a natural added value because many experienced patients that have chronic disease, for instance, understand the risk of infection. Some caregivers understand the problems relating to integrating into a care team. Some of our patients who have mental health issues know intimately well the problems tied with isolation. So these patients have extremely important knowledge in such a crisis, in such a pandemic, and that's what's extraordinary. And that's what we were at risk of losing. And what's important to note is how patients were able to anticipate. In all the conversations we had with patients, they were able to anticipate what was going to happen 2-3 weeks ahead of time, even before the healthcare leaders were able to do it, because they say, for instance, I'm a hemophiliac, I have HIV, I understand what I'm up against, and therefore my prior experience informed what I could expect in the future. So the contribution, the main contribution outside of their experience as patients, in all conversations, we had a lot of conversations with the ministry with respect to triage, for example. It's very difficult. For instance, if you had a shortage in ICU or in the ER, we had patients get involved in that conversation. What did the patients contribute? Well, they managed to explain that triage often entails the principle of maximizing benefits. So we want to maximize benefits around a priority area. Patients constantly talked about equity, not just maximizing benefits, also equity. And that was really important. That enabled us to avoid the fact that some people weren't pushed to the side and weren't targeted in these triage methods. We didn't want categories of patients to be singled out. We wanted to have more equity amongst all patients. We also insisted on establishing communication in terms of triage. We wanted to make sure that patients were still informed, that they were still involved in transparent communication, that they were still asked what their needs were. And we also talked about dignity in Quebec. As you saw, there have been a lot of deaths in ERs. At one point, ERs were overwhelmed, and we were afraid that people would die alone in the hallways. So we pushed really hard to say, no, it's not because there's a current pandemic that people have to die alone in a hallway. They still need to be in contact with their family. We need to find ways for them to die with dignity. And of course, one thing that we systematically brought to the floor was the fact that families are really important from at the outset, since that families were on the periphery. I can tell you that in all the conversations we had, we neglected families, because in any case, families weren't integrated. They weren't even allowed in the system. So we weren't talking about families, and we constantly brought it back to the floor, the fact that families have to be involved. Families have to be engaged with the patients and the care team. We also talked about the language that's used in the documents that are produced and that are published throughout Quebec. We wanted to make sure that the right words were used, that we choose words wisely. This is something that patient partners and caregiver partners also spoke to. And also, whenever patients and caregivers are part of these talks, they always talk about a lifelong trajectory. We look at it systematically. We helped organizations get out of their silos. Patients and families are often involved in difficult conversations, end-of-life care, palliative care. So we look at the entire life course, the entire course of a disease, the whole pathway. We don't look at an episode of care, an emergency, one specific department. So what we contributed in our conversations was that systematic approach, this ability to look at the pandemic in a more holistic way, in a more integrated way. That's what we did in our work with the ministry, and it's also what we did in our work with researchers. I co-lead this new network on research in Quebec with respect to COVID, and it was also part of the conversations we had with the hospitals in Quebec. So in conclusion, I'd say that we were privileged to be asked to be part of the conversation, as Caroline said. I want to thank the patients that got involved. It wasn't easy for patients and families because talking about triage in the ER, triage in the ICU, you're talking about yourself. You're talking about establishing criteria that could exclude you down the road. So the conversations were emotionally difficult at times, and I did want to thank them for being part of it. And I also wanted to raise the fact that some patient partners didn't have an opportunity, unfortunately, to get involved. And I find that really disheartening because we missed something by not involving as many people as we could and tapping into their knowledge early on in the crisis anyway. That got corrected over time, but it is unfortunate. I want to thank the CHUM in Montreal, their CEO, the health minister in Quebec, who's really supportive of patient partnerships, Maria Boutillier, who also got involved in tying patient partners with research. There's a new network being created in Quebec. They want to include patient partners even in research. So those are just examples. That doesn't mean that in Quebec everything was perfect, very far from it. The vast majority of patient partners were not engaged. So we were very lucky at the center to be part of it. We think it's unfortunate that it wasn't more widespread. However, what we can say is that patient knowledge and caregiver knowledge, family knowledge is added value. It's really important. And I have HIV, and I lived through the 80s. We know how in the 80s, the early 80s, patients helped the health system evolve. We know how important it is to have a partnership with patients. And now what we see in Quebec with the major crisis in long-term care facilities is a partnership issue. It's an overall partnership issue. There's a problem with collaboration, with bringing families into the fold. So more than ever, partnerships in care are timely. And more than ever, we have to show that patients should get involved. Families should be involved in sharing the knowledge and in preparing for the next crisis. And we really hope that even if things were put on hold for a while, that they will rise from this and that that patients and families will be involved in preparing the next crisis so that we have a constructive approach to the future. Thank you.
Thank you, Vincent and Carolyn. Wow, that was action-packed in so many ways, and I could see the chat box just filling up, you know, really demonstrating both the push and the pull in this area of being asked to come to tables, but also how your organization was pushing, and in particular, that demonstration of the value of engagement. Really liked the commentary, Vincent, related to anticipating needs, knowing patients, anticipating where the system needed to go and thinking in that very holistic, integrated way. And I could see many comments that were consistent and asking similar things related to how are we ensuring engagement approaches and strategies are there ready to go for the next wave that people are anticipating, and saw many, many comments in the threads regarding that, and a lot too around the welcoming of families as true partners in care, essential allies, and the importance of keeping that at the forefront. I'm going to hand it over to Claire as we move into questions, and it'll be a more rapid fire question than usual, and we had started, and I think this is where the conversation has certainly led us, the slow start to engagement, but how it has been increasing and accelerating in more recent days, but continuing that there's more work to do. So Claire is going to show us the results of the poll that you all answered when you first came on, and in the early part of the session, and then we're going to move right into the questions that Claire will get us started on. Over to you, Claire.
Mm-hmm. Okay, thank you very much. And I actually just saw a question that came up asking about the polling results. So hopefully you can see that on the screen, I'm hoping. So during the first 4 weeks of, they're coming to the polling results shortly, I'll just take you through that. During the first 4 weeks, most people did not see an increase. The majority, 74%, saw a decrease in their engagement activities, and a slight percent saw just staying the same. But then what we took is, what is the pulse check right now? And what we found is that most people, well, 48% of people have seen an increase in their engagement activities. We've seen most people are not seeing a decrease. So that's a good. I see that as saying that the traffic light has moved from the on hold to we're starting to see a way forward. And we're starting to see, it's moving forward, which is good. But I think there's still definitely momentum that can continue. And I think hopefully from today, what I've been seeing in the chat boxes, there's definitely more room for opportunity and improvement. There's obviously some challenges that are still going on with regards how do we get the patient voice and the patient engagement going forward, especially when there are potentially healthcare teams and authorities that are questioning how that looks. Is the opportunities to get the patient engagement framework stronger and partnership opportunities stronger. So that discussion, I think, definitely still needs to be had at the table. But I think what we'll do is, in the interest of time, is move straight on to the first question. So if we can bring that slide up, would be fantastic, because I know the chat box is going to light up. And the first question, let's just check if the slide is up. The first question we have today is, what innovative and creative approaches have you seen in patient engagement practices during the time of COVID? And I think we'd love to hear from across Canada as well as past our borders, because we have some international participants today. And I know, I'd love to hear and learn from other patient partners, because that's how I figured out my way forward and action plan. So any ideas or anything that you've heard from other patient partners, put them down in that chat box. I know we'd all love to learn. And we'll give you some time to do so and give a bit of quiet space to do that. So have a go.
I would like to make a comment before the chat boxes had turned over. There was a question about long-term care, and I think you had ended the conversation as well. Vincent was pointing out, and I think as we've all realized, with this crisis that we've all been dealing with, it has certainly revealed the cracks that exist within the system, and the long-term care sector being one of them. And what I would like to point out, certainly within this discussion series of patient engagement, it really is the engagement across all sectors, at all levels of the health system, and in all domains. So many have also talked about the work and research. I saw out of the folks, the Center of Innovation out of the University of Manitoba, talking about the increasing engagement that's happening, although in a shorter turnaround time in the research world. And so wanting to know that this discussion series certainly broadens out to all sectors. The work specifically that CFHI is doing in the area of Better Together and family presence policies has started more in the hospital and acute care sector, simply because that's where the evidence has existed and the work that we've done in the past. But we're certainly moving in that direction in long-term care with the work that we're doing. So certainly welcome comments from all perspectives here. So I'm seeing some congratulations to you, Vincent, for all of the involvement that's happening out of Quebec. Definitely a lot of themes that are emerging related to the innovative and creative approaches that look at virtual means, coffee chats, phone calls, virtual visits, and also through peer support and social media in terms of connecting people where it can't be done in person, but looking at other ways of bringing it in. And I think, again, to the point that was raised earlier around often it's a quicker turnaround, because of the crisis of wanting to put change into place quickly, but also seeking for those opportunities for engagement. Certainly increased inclusion of knowledge translation initiatives, particularly research that's included patient and family partners, and I think also, though, being very mindful of technology and where people may be unfamiliar or unused to dealing with technology, or where there isn't simply the access. I'm wondering, Claire, in the proposal that you've brought forward in the BC approach now that's happening in your region, are there particular approaches that you're looking to embed, knowing that a lot of this may not happen in person in the way that we've done engagement in the past?
Yeah, absolutely. I mean, I think a lot of what I'm seeing here is obviously switching to virtual, and definitely our engagement with the council will definitely be in a virtual capacity for sure, with the aim that maybe potentially one day we can meet in person, but definitely virtual capacity. A lot of the engagement that we do already, some of it is virtually done and online and not in person, so we'll continue in that vein. One of the things I just wanted to comment on, which actually alluded to a previous question which came up, which I'm seeing in the chat box now, is a lot of patient partner mobilization and engagement that has been happening. And I think I alluded to that in my talk earlier, but I think that's one of the things that we can use to the advantage of patient partners going forward, is how to shift the momentum forward. If there is a challenge in getting engagement opportunities going forward, is using that initiative, using that learning that we're getting from patient partners across Canada, globally, and ideas that are percolating around, is looking for those opportunities within, whether it's your healthcare authority, your PFAC, and bringing that to the table with the healthcare authority, who are scrambling around, whether it's in their response mode and are now moving to recovery mode, to actually bring that to the table, to the healthcare authority in a proactive manner, to say, you know, this is working in this area here. I feel this could be really a good idea for our healthcare authority or our PFAC to look at. How about we look at it in this way? Because I feel like it's such obviously a very understandably shift and mode towards the response mode for COVID, that there has been very little attention to patient engagement and partnership. So now that we're going into recovery mode in certain provinces and territories, use that opportunity to learn from other patient partners and potentially bring those plans and ideas forward if you are able to.
What I'm seeing, what I'm liking in the chat box is really noting that there are many structures that were already in existence for patient engagement, and that how people are shifting, still utilizing the same structures, but doing so in a very different way. But as noted again, the speed in which some of the engagement needs to happen is very different now during this time. Before we move on to the next question, I'm just wondering if maybe, Vincent, if you could address this one question of just really ensuring that we're elevating this conversation to provincial and health system leaders to ensure that there is responsibility for collaboration that needs to happen, and ways in which you manage this in Quebec through the center, and any ideas that you may have to ensure that this remains on the radar of senior leaders of the health system.
Obviously, to achieve that, you either need to have a partnership and engagement strategy, but you also have to support it by research. So you have to be able to demonstrate that you're adding value. That's fundamental. And CFHI has been of tremendous support by assessing various initiatives. It's something that can be done in centers such as ours in Quebec, but in Ontario and in BC, Alberta, and elsewhere. So decision makers need to understand the value. The value is evident. It's easy to demonstrate, but it's not because it's easy to demonstrate that you shouldn't demonstrate it. So what we do at the center is use a SPORE, a strategy on patient-oriented research, and we use that to show the value. We've done it, in fact, before the pandemic. That's why we were already part of the talks. Some decision makers are already convinced that there is added value in patient partnerships, and that's something that's been built over years. It's something that we never give up on. So if you want a partnership between researchers, patients, families, and decision makers, you have to build it over years. You can't ask people to just believe in you, especially when there's a crisis. You need data, you need evidence.
And so certainly from what you're saying, Vincent, building up that culture of engagement that is foundational. And I think that leads us nicely into the next question. Over to you, Claire. And I think our broadcast team will shoot up the next chat box for us. But Claire, over to you for the next question.
We are there. So the next question is, what has enabled the strengthening of patient engagement and partnership during this difficult time, and what challenges actually still remain? I think, what can we acknowledge as areas of strength that have enabled our patient engagement and patient partnership? At the same time, what areas do we know that have potentially been barriers and challenges to meaningful partnerships during this time?
Now I'm seeing right off the bat, leadership is coming up, as well as communication, trust, many of these foundational pillars to engagement in itself, and really in the development of relationships that is foundational to our engagement work. Carolyn, I'm going to bring you in very quickly to speak to this notion of leadership, and what does that look like? You are a co-led center of excellence, and the leadership that exists there that has helped to propel the work that you're doing.
So thanks. So I definitely wanted to make this point because, to be entirely transparent, so much of what we've been able to do over the last 2 months also wouldn't have happened if we didn't have Mr. Vincent Tunais as our patient leader, and a lot of the other patient and family leaders that we have, not only in our team at the CRPPP, but throughout Quebec right now. And that has played a huge role in not only making sure that the culture has understood the value of experiential-based knowledge, but also that we've already had some practice and some, like I said, sort of proof, for lack of a better word, of working at these very strategic levels, at these multiple levels of the healthcare system, with patient and family leaders, and kind of being able to mobilize this type of expertise in a way that's that we were able to mobilize in this period. I'm not saying that it's been easy, for sure. Like Vincent had mentioned, there was definitely some ethically challenging discussions, but we actually had this discussion this morning around our team call. The other option was to not be around the table. And that's, and we've seen how being around the table, and the simple fact of being around the table, is incredibly important, and how just having been around the table before was able to be mobilized during this pandemic, and will help us strengthen and mobilize for the future so that we can all be better prepared for what's to come. But there's also been, we have also examples of where things were stopped and where there was the same fears and the concerns about getting patients and family partners involved. So I totally agree. It's something that we've been thinking about and would love to reflect at a later time with all of you with regards to that role of patient leadership. But we obviously promote the possibility that patients and family partners and patient leaders should be systematically included at all levels of our current system.
Thanks. I'm going to wrap this section up, and I'm just noticing this one comment from Sydney Graham of, we're only invited to the table, we don't have a permanent seat at the table, and I think that's something to consider, with many great comments related to culture, creating that culture, the transparency, the openness that is required. So we are moving to our last question in the last 3 minutes. Certainly, again, you will see a very robust summary coming from us because there are so many great things here. And I think many new questions that have been posed that we can certainly follow up on. Over to you then, Claire, with the last question.
I know. I'm having a great time. Okay, you're going to have to get going, everyone. How do you think this time of COVID may have changed the patient engagement landscape moving forward? So I did post a comment, but there's so many comments going through that it's just the amazing volume here. So have a go and see what you've got. I was reading an article by Jason Moore from the Barrel Institute where he actually talks about a new normal. There will not be a new normal, but rather a new existence for healthcare and the human experience. And I suggest having a look for that on the Barrel Institute website. And I'm pondering maybe, given everything that everyone's talking about, is there actually a new existence for patient partnership and patient engagement and patient partnership going forward, and what does that look like? So it was actually really timely that I read this article, and I'm interested in see what people say about this question.
And I think building on, and in the last minute, Vincent, Carolyn had left us with this notion of patient leadership, and certainly thinking about the future of patient engagement and the landscape moving forward. Would certainly welcome your 30-second comments on this as we're wrapping up. And as I'm scrolling through the comments as well, please weigh in, Vincent, on patient leadership moving forward.
Well, that's the crux of the issue, isn't it? We have to continue to build our leadership capacity. I think that we've managed to demonstrate in research and in care the value of patient partnerships. I think now, Canada-wide, and certainly in Quebec, what we need to find is more support at the political level. It's interesting because there are other areas such as France where public policy is informed by patient partners. However, it's not applied very quickly. And here in Canada, it seems to be the opposite. We apply patient experience to our care. However, we're not really part of political decision-making circles. So I think that that's the last frontier. If we want to make sure that we're sustainable, we need a framework, and it needs to be supported by political leaders. We've demonstrated our values, so let's move on to the real deal. I think that that's what the crisis has illustrated.
Thank you. And on that note of optimism, I think what we are going to do is wrap up here with a huge thank you. You could see the interest in this topic area. Many, many thanks for everyone that's been continuing to put comments in. A huge thank you to our presenters, Vincent and Carolyn, and of course to our host, Claire, and to our broadcast team, Kelly and Sheena, who make all of this possible, Isabel and Haley and Jesse in the back rooms that are doing so much to make sure that we're able to put on these discussion webinars for you. There is a poll up here. Your feedback is so valuable to us. And so if you can help to shape future webinars, we would greatly appreciate that. This is the last of the first set of 3 series for our patient engagement in this time of COVID-19. Based on the ongoing enthusiasm for these discussion series, we will be continuing on. Please stay tuned as we will be sending out notices about the next ones that will be happening through June and July. And with that, we thank you for your time today. We thank you for your ongoing energy and commitment to the this area of engagement. And as always, we welcome your feedback on what we are doing here at CFHI and how we can continue to connect all of us across Canada to have these kinds of conversations on this very important area of engagement and partnership. Thanks to all. Have a great day, and wishing you to stay safe and to stay healthy during this time. All the best. Bye-bye.